Sometimes people call diabetes a touch of sugar or borderline diabetes. Diabetes is a chronic that occurs when your blood glucose, also called blood sugar, is too high. Blood glucose is your main source of energy and comes from the food you eat. Insulin, a hormone made by the pancreas, helps glucose from food get into your cells to be used for energy. Sometimes your body doesn't make enough, or any, insulin or doesn't use insulin well. Glucose then stays in your blood and doesn't reach your cells. Over time, having too much glucose in your blood can cause health problems. Although diabetes has no cure, you can take steps to manage your diabetes and stay healthy. You can develop type 2 diabetes at any age, even during childhood. However, type 2 diabetes occurs most often in middle-aged and older people. You are more likely to develop type 2 diabetes if you are age 45 or older, have a family history of diabetes, or are overweight or have obesity. Hyperglycemia, also called raised blood glucose or raised blood sugar, is a common effect of uncontrolled diabetes and over time leads to serious damage to many of the body's systems, especially the nerves and blood vessels. In 2014, 8.5% of adults aged 18 years and older had diabetes. In 2019, diabetes was the direct cause of 1.5 million deaths and 48% of all deaths due to diabetes occurred before the age of 70 years. Another 460,000 kidney disease deaths were caused by diabetes, and raised blood glucose causes around 20% of cardiovascular deaths. 1. Between 2000 and 2019, there was a 3% increase in age-standardized mortality rates from diabetes. In lower middle-income countries, the mortality rate due to diabetes increased 13%. By contrast, the probability of dying from any one of the four main non-communicable diseases, cardiovascular diseases, cancer, chronic respiratory diseases or diabetes, between the ages of 30 and 70 decreased by 22% globally between 2000 and 2019. The most common types of diabetes are type 1, type 2, and gestational diabetes. Type 2 diabetes. Type 2 diabetes, your body does not make or use insulin well, results from the body's. More than 95% of people with diabetes have type 2 diabetes. This type of diabetes is largely the result of excess body weight and physical inactivity. Type 2 is the most common type of diabetes. Symptoms may be similar to those of type 1 diabetes but are often less marked. Until recently, this type of diabetes was seen only in adults, but it is now also occurring increasingly frequently in children. Type 1 diabetes. Your body does not make insulin. Your immune system attacks and destroys the cells in your pancreas that make insulin, requires daily administration of insulin. In 2017, there were 9 million people with type 1 diabetes. Neither its cause nor the means to prevent it are known. Symptoms include feeling very thirsty, urinating more frequently than usual, particularly at night, feeling very tired, weight loss and loss of muscle bulk, itchiness around the genital area or regular bouts of thrush, a yeast infection, blurred vision caused by the lens of your eye changing shape. Gestational diabetes is a type of diabetes that can develop during pregnancy in women who don't already have diabetes. Every year, 2% to 10% of pregnancies in the United States are affected by gestational diabetes. Women with gestational diabetes are at an increased risk of complications during pregnancy and at delivery. These women and possibly their children are also at increased risk of type 2 diabetes in the future. Gestational diabetes is diagnosed through prenatal screening, rather than through reported symptoms. Lifestyle measures have been shown to be effective in preventing or delaying the onset of type 2 diabetes. To help prevent type 2 diabetes and its complications, people should lose extra weight, be more physically active, doing at least 30 minutes of regular, moderate-intensity activity on most days. More activity is required for weight control. Eat healthy plant foods, avoiding sugar and saturated fats, and eat healthy fats. Avoid tobacco use. Smoking increases the risk of diabetes and cardiovascular disease. Skip fad diets and make healthier choices. When to see your doctor. The American Diabetes Association recommends routine screening with diagnostic tests for type 2 diabetes for all adults age 45 or older and for the following groups. People younger than 45 who are overweight or obese and have one or more risk factors associated with diabetes. Women who have had gestational diabetes. People who have been diagnosed with prediabetes. Children who are overweight or obese and who have a family history of type 2 diabetes or other risk factors. Share your concerns about diabetes prevention with your doctor. He or she will appreciate your efforts to prevent diabetes and may offer additional suggestions based on your medical history or other factors.